Every day, 30,000 patients worldwide are treated with medical isotopes from the HFR in the Netherlands. We have to, because cancer has been one of the most common causes of death in the Netherlands and Europe for years. We've asked Professor Dr. James Nagaraja, nuclear medicine physician at the Radboud UMC, about his take on how to beat cancer.
I truly believe that this decade is going to be the nuclear decade, looking at the innovation and developments in the field, what we have so far and what we're going to do in the next 10 years. The production of Lutetium-177 is quite complicated, so there are not that many reactors worldwide to produce Lutetium-177, first. And second, once the PSMA treatment got registered, I expect end of this year, beginning of next year, then there will be a high demand of Lutetium-177 for a lot of patients. We need a reliable production place for this compound in the future.
Isotopes are produced in two ways, through cyclotrons at hospitals and manufacturers such as Curium, but by far the majority of isotopes are produced in nuclear research reactors, especially for therapeutic applications. Worldwide, there are 7 reactors responsible for the lion's share of the production of medical isotopes. Most of these reactors are 40 to 60 years old, and in the coming years, several reactors are going to stop. So we are facing a challenging supply and demand situation. The demand will grow as millions more citizens will develop cancer in the coming decade, and dozens of very powerful search and destroy medicines will reach the market. The challenge is, how can supply keep up? As several reports by the European Commission have shown, additional reactor capacity will be needed in Europe, not only for global security of supply, but especially to preserve Europe's leading position and self-reliance. PALLAS is considered the most advanced initiative in Europe. We've asked Titus Stielens, Strategy Director at PALLAS, to explain the future role of PALLAS in the EU.
PALLAS is unique because it is especially designed to mass produce a wide range of medical isotopes. And to give you a sense, when in operation, PALLAS has enough capacity to provide all of the demand for molybdenum in Europe, for all of the processes in Europe, as well as to produce 200,000 curies of lutetium, which is more than the total capacity of existing reactors combined today. In addition, PALLAS will have some flexible facilities to adapt in the future if new applications arise and to produce new types of isotopes. PALLAS is not only developing a new nuclear reactor, but also what we call the Nuclear Health Center. And the Nuclear Health Center will be a general facility for the bulk processing of radioisotopes. And this will greatly enhance the efficiency of the nuclear medicine supply chain. Because if you look at today's situation, each pharmaceutical company needs to figure out how they can process the isotopes that are coming out of a reactor. It's not something they're equipped to do, and it's very inefficient if every company needs to build their own facilities. So the idea of the Nuclear Health Center is to combine all of those production lines to be able to produce in high volumes radiochemicals for a range of pharmaceutical companies. And this will provide huge benefits to the customer. It will avoid a transport step with nuclear materials. It will avoid decay time. Therefore, it will reduce nuclear waste. You will get more product out of the target material. And there are economies of scope and scale.
An initiative to accelerate the development of new nuclear products is Field Lab in Petten. Sander de Groot, Senior Program Manager, Isotope Development Program at NRG, explains.
The Field Lab is a collaboration between academia, research institutes, industry, startup and spin-off companies, all with a focus to develop new radiopharmaceutical products. And the Field Lab intends to accelerate the development of these new therapeutic products and get them to the market as quickly as possible. Petten is a unique site with a unique combination of nuclear infrastructure such as a reactor, hot cell facilities, laboratories. And currently we are producing about 30% of the world demand in medical isotopes in a very affordable and economic way. The fact that you have a reactor in which you can produce large amount of isotopes makes an economic case for production of isotopes. This is now the case for example, molybdenum, but in the future this will also be the case for therapeutic isotopes. So we intend to expand the facilities here in Petten with field lab infrastructure to be able to support the innovation of new therapeutic medical isotopes as a support for the reactor, for future PALLAS-reactor, and to, of course, beat cancer.
PALLAS will be needed to sustain a strong European infrastructure for the development and production of nuclear medicines. Together with the reactors, PALLAS will form the backbone of European production in the future. A lot of new developments are coming from Europe, from university medical centers, and from startups. Pharmaceutical companies are attracted to Europe precisely for the reason that there is a network of several reactors that together can operate 365 days a year, which you don't find in any other continent. Having this network of reactors is very important for European self-reliance, today and in the future.